oncology is this. Surgeons that deal with cancer in a way that can be aware not only of what surgery can achieve, but how we can combine it with other treatment options for the best of the sake of our patients. So here's number one, Professor Chima's slide. This was really very interesting cases to see these bulky, locally advanced tumors, some of them Rosnelling, and to see how you can achieve incredible good results of first removing the tumor with margins, and second, providing coverage for the defect. Certainly we're not talking about aesthetics here, but we're talking about a reasonable coverage of the defect so that the patient can keep on to have a normal life. The result is really excellent. I'm saying this about comparative epidemiology because I found it very interesting to tell you what happens in Spain, for example, or in Europe. In Spain, we have been a developing country also in the past, or an emerging country, I like to say, and we have seen cases like the one I presented before in the past, but nowadays our epidemiology for breast cancer is more what you're seeing here. You know, small tumors, small incisions, so we do tumorectomy for very early cancer with sentinel lymph node dissection, as you can see here. And of course the cosmetic result is very good, and more oftentimes patients want to have reconstruction, but not to cover a defect, but just for aesthetic result. You can see some very good aesthetic results here that have a different goal, not to cover a defect, but to achieve good cosmesis. So I'm just giving you, and along the way, some examples of this comparative epidemiology on how advanced cancer presents here and how we're losing that kind of presentation in Spain and maybe in Europe. Of course, sometimes we need to do mastectomies, and of course, we have complications from mastectomy too. So basically, no one anywhere in the world is free of either having complications or doing the right or the bad thing. The thing is, with the things and the resources you have, you should achieve the best results possible for the patient. Professor Chima also shared with me this slide of this submaxillary gland tumor. Very impressive, I should say. Never seen anything like this. But again, the epidemiology in Pakistan, as he was referring to in his slides, is this. And as I said, in the past, I'm talking about maybe 20 years ago in Spain, this was like this too. But again, the result here is just fabulous. So another reflection here is this. You, as a surgical oncologist in Pakistan, can deal with locally advanced malignancy of the salivary gland, of the breast, and of the scalp, and of many other locations. Whereas here in Europe, fortunately, or maybe unfortunately, we have a trend towards a hyper-specialization. So this kind of tumors would be treated here by a head and neck surgeon, and maybe not by a general surgical oncologist. And here, maybe unfortunately again, we're losing this kind of the general vision of surgical oncology for a trend to a more site-specific surgical oncology. And again, now we're becoming more and more dependent on reconstructive surgeons. Whereas in the past, surgical oncologists here were able, like you are, to cover their own defects. So again, another comparative, not epidemiology, but practice pattern from Pakistan and from Spain or Europe in this kind of tumors is that maybe we're losing that ability to deal with many things as you're doing over there now. However, we happen to see from time to time cases like that. This is a case in MD Anderson Cancer Center Madrid from about 5 years ago. This is very advanced, locally advanced melanoma, actually recurrent melanoma in the axilla. You can see some satellite lesion here. This patient has intractable pain from brachial plexus involvement. So this patient, maybe for a different reason, maybe it was in a term more palliative, because the patient certainly didn't have any metastasis, but we can also know that this is not curable disease. This patient You can see him from here, from the head, really advanced locally cancer. You can see him from the back. This is the back, the scapula, the armpit. You can see here the arm, and we